Did you know October is World Menopause Month? It's observed every October, raises awareness about menopause and the support women need during this natural stage of life. And join us right here live on The Splash to give that professional perspective on menopause. We have staff physician, board certified OBGYN, and certified menopause practitioner by the Menopause Society, Dr. Robert Goldfarb. Thank you for being here, doctor.
Thank you for having me.
So we're talking about a natural stage of life for most women that they encounter, but I want to kind of just talk about the evolution of it. How has the medical understanding of menopause evolved over the years?
Well, I think first of all, I think the understanding is people are more willing to talk about it than they probably were in the past. And there's more options for helping people than there used to be. Used to be the only option to really help people through menopause with a lot of menopause symptoms was estrogen. And there are people who don't want to or should not take estrogen. So we have a variety of other medications, lifestyle changes, things like that. And so you can help people. Normally, you can deal with their symptoms and make their symptoms better. I mean, unfortunately, we're all going to age. We can't do much about that. So it's important to eat healthy, not smoke, alcohol in moderation, exercise, that sort of thing.
Yeah. Yeah, no, and we all be fortunate enough to get older to experience things like this natural stage of life and things of that nature. But like I said, it affects women at a certain age of life in most cases, and it's just something that we all try to help them deal with. Now, I want to kind of scale it back a little bit before I dig a little bit deeper into this. Let's just talk about, since I have you here, doctor, what is menopause?
Well, the absolute definition of menopause is cessation of your menstrual period for 1 year. That's the hard, fast definition.
Okay.
Normally during that time, which occurs usually in the early 50s, 51 to 52, is the average age. People's periods stop. Sometimes they get dragged out longer apart, then eventually they stop. So you're during all this process, you're perimenopausal, and then after you've not had your cycle for a year, you fit the definition of menopausal.
Interesting. Okay, thank you for breaking that down. I felt like that was important to kind of get as far as, before we actually continue, just for anyone listening or watching who just want to get educated on that aspect of it. Now, with that being said, doctor, I'm pretty sure a lot of your patients come to you with questions, just probably people just in a natural conversation may ask you, but overall, what are some common misconceptions about menopause that you may hear that we want to debunk now?
Common misconceptions. Common misconceptions are everybody has to go on hormones. Common misconceptions are that people are going to stop having sex.
Oh.
And I think that some people just kind of go into it thinking it's going to be, very difficult, very miserable, worst time in their lives. And for most people go through this fairly unscathed.
Oh, wow. Yeah, I could only imagine, like I said, being a male and being in my 30s, I have no idea. But having a mother, an aunt, a grandmother, I know, like we said, we all know someone who may have been affected by menopause or going through menopause. But joining us right here live on The Splash, staff physician for Henry Ford Medical Group and certified menopause practitioner by the Menopause Society, Dr. Robert Goldfarb, talking about World Menopause Month being in October specifically. Now, we know that there are some challenges that women face during menopause, like we just kind of went over. Can you just talk about what you kind of recommend to manage those challenges?
Well, there are challenges of people who have what we call vasomotor symptoms or hot flashes, and when you have hot flashes and you're sweating at night, it's difficult to sleep, so you get sleep disturbances. Um, some people report mood swings and things like that.
Hmm.
The other thing with menopause is bone loss increases, so higher risk of osteoporosis. So you have to be on the lookout for that. In terms of treating people, um, there's medications you can use for hot flash symptoms. Mostly we like to use hormonal therapy, but there are non-hormonal therapies that are available that work well, although I don't think as well, for those people who do not want to or cannot take estrogen.
Hmm.
The other thing is sometimes estrogen will help people with a variety of symptoms, the hot flashes, so they sleep. Some people feel a little brain fog. Maybe that's caused by sleep deprivation,
Okay.
um, etc. So everybody's a little bit different, and everybody's going to react to medication differently.
Correct.
If we're just trying to control hot flashes, sometimes there are medications such as some of the antidepressants. There's a nerve pain medication called gabapentin you can use. There's another medication called ditropan, which is a bladder medication that's used for that. So we have a variety of ways to help people with their symptoms.
Hmm. Yeah, yeah. I'm learning a lot right here just listening to you, doctor, and I appreciate that too. But something that you mentioned that I want to kind of go back to, the hormone replacement therapy. Can you explain both sides of the coin when it comes to that, the benefits and the risks when it comes to using HRT in for
Sure,
managing menopause symptoms?
sure. Um, the benefits are, well, first and foremost, you're probably going to knock out your menopause symptoms. So that's a good thing.
Okay.
Um, if you're having vaginal dryness and discomfort during intercourse, it's probably going to help with that.
Hmm.
Um, so those are the big issues. Some of the minor things of menopause, it may help. Some people say it makes their skin better. Um, it definitely helps to prevent against osteoporosis or bone loss.
Hmm. Hmm.
Um, what's the downside? Well, the downside is it's a medication you have to take, and it's probably only going to be effective for as long as you take it.
Hmm.
That's the first thing.
Right.
Second thing is, okay, second thing is side effects from the medication. And what I mean by side effects is they may have vaginal bleeding. Some people get bloating. Some people get abdominal cramping, breast tenderness. These are not huge numbers, but it definitely does happen. And the statistics show that most people who are started on hormone therapy won't be on it a year later. They will self discontinue.
Oh, okay. Interesting. Interesting. So it seems like it's essentially just a short phase of treatment and medication, essentially. And like you said, it's only effective for as long as the patient actually takes the medication for
Right,
that therapy.
right. And, the Menopause Society says 5 years,
Ah,
and then you can kind of wean people back.
okay. Ah,
And, you have to see how they do and stuff like that.
right.
When you have somebody and you want an age group under 60, when you have somebody who's older or somebody who has been on the medication longer,
Mm-hmm.
you need to have a discussion of the pros and cons, and the patient can help you make the decision what you're going to do.
Right.
I have a fair number of people who are, way past 60 on hormone replacement, and they don't want to give up their hormones because they feel good.
Mm, oh, okay.
And, it's a shared decision.
Right, right.
Um, Downside of hormone therapy, like I say, it's medication you have to take. You may have bleeding. Statistically speaking, there's a small increased risk of blood clots in your legs or lungs, which is diminished when you do the hormones, the estrogen transdermally or through a skin patch, as opposed to orally. Um, so
Yeah.
the that's the issue,
Right.
and there are some questions of menopause, hormonal therapy beyond the age of 60, um, increase speeding along dementia.
Oh.
So, there's a lot of information for a patient to digest
Correct. Correct.
and to see what she needs to do.
Right.
And the other thing that I'm an advocate of, it's also important to feel well.
True.
And if you're not feeling well, it's no good.
Yeah, yeah. And that starts with
So,
the mental. That starts with the mental too, doctor. And I know we're very, very pressed on time, but I wanted you to speak on that. Menopause can cause mental health changes as well, increased anxiety, depression. How do you approach this, people dealing with this very briefly?
well, I mean, I think if you approach this, if people are having significant problems, I think the first thing is that they talk to a counselor or therapist.
Right.
I think that that's, important to have somebody to talk to. And I think I'm personally of the belief that almost everybody can benefit from therapy at one time or another.
Yeah.
But
Yeah.
um, there are medications you can use for that. You can use um, some of the antidepressant medications. You can use Paxil. You can use Effexor. You can use you can use any of them,
Okay. Okay.
and it'll help. It'll help a lot of people, and they're pretty safe to use.
And that's good to know that you are providing those resources for that, doctor. And we appreciate your time. Lastly, if people just want to know more information regarding this, or if you have any message for people experiencing menopause right now, please do so.
Um, I think you have to. I think you have to see what your symptoms are, see how you're doing. If you're not having significant symptoms, great. If you are, and these are bothersome to you, seek out a provider, somebody who can help you. You don't have to go through this and suffer.
Yeah. Yeah, and that's great information. Essentially, don't go through this alone. There's plenty of people and resources out there available. Thank you again. Once again, we want to thank you, staff physician from Henry Ford Medical Group, certified menopause practitioner by the Menopause Society, Dr. Robert Goldfarb. We appreciate your time, sir.
Thank you very much.